Hi friends, in this video we shall discuss about spinal cord injury. Mainly we are focusing on how the injury occurred. What is the nature of injury? The second one is what happened due to that particular injury. And third thing, the prognosis of that particular injury. What is the prognosis of that particular injury? What is the outcome of that particular injury? And fourth thing is in which all conditions conservative management is possible and in which all conditions surgical reference is needed. And four things, mainly four things, how the injury occurred, history of injury, and what happened due to that injury. Third thing is prognosis or outcome of that particular injury and conservative management possible or not. Coming to spinal cord injury, the statistics earlier in previous videos, we already discussed that the most common condition which occur in cervical spine is injury. So that we shall able to see 50% of total spinal cord injury occurs to cervical cord. Lumbosacral region is least affected, but lumbosacral region is prone to degenerative conditions, this disease and degeneration like osteoarthritis or spondylosis. Coming to the causes of spinal cord injury, you may see that RTA is the most common cause for spinal cord injury. False sports activities, acts of violence, such conditions also cause spinal cord injury. In the last slide, we discussed the prevention of spinal injury is the most important thing regarding injuries to spinal cord to prevent, so that in most conditions it may affect the life or quality of life of that particular patient, and it may affect the entire family, so that prevention of spinal cord injury is of utmost importance, which we shall discuss later. Coming to spinal cord injury, the basic thing we want to know is three columns: anterior column, middle column, and posterior column, out of which anterior column includes anterior longitudinal ligament ALL and half of body of vertebra and half of intervertebral disc. Middle column includes half of the body of vertebra posterior and posterior half of the disc and posterior longitudinal ligament. The posterior column includes vertebral canal or spinal canal and the posterior structures including spinous process, interspinous ligaments, supraspinous ligaments all include under the posterior column. The basic thing regarding this is whenever two columns are affected, it's an unstable injury. Whenever only one column is affected, it's a stable injury. This is a sagittal view and this one is axial view. Here you shall see this one is anterior column, this one is middle column, and here you shall see posterior column. Anterior, middle, and posterior column. Coming to the classification of spinal injuries, it actually includes total 7. One is flexion injury, second one is flexion rotation injury, third one is vertical compression injury, fourth one is extension, fifth one is flexion distraction injury, sixth one is direct injury, and seventh one is indirect injury due to violent muscle contraction. These are the classification of spinal cord injury. Coming to flexion injury, it is the most common injury. In most cases, it may be stable. Flexion rotation is the worst injury, and in most of the cases, it's unstable. Vertical compression injury may be stable or unstable, which is not much common. Extension injury also, if it's continuously in extension, the patient is not reduced, then it's unstable, otherwise it's stable. Flexion distraction injury nowadays very rare, occurring due to actually seat belt, which is only around the abdomen, not in the chest area, and it's the cause of flexion distraction injury. Nowadays it's very rare. Flexion distraction injury is an unstable injury. Direct injury, it may be stable or unstable as per the cause. It may occur due to a lathy blow or due to gunshot. In lathy blow, it causes spinous process fracture only, which is a stable injury. The gunshot may be stable or unstable according to the site which is affected. And this indirect injury due to violent muscle contraction is a stable injury, which is causing fracture of the transverse process of lower lumbar spine. In detail, we shall able to see this is flexion injury. This one is vertical compression injury. This is an extension injury. The head is hitting towards the windshield. This one is flexion rotation injury, which is the worst injury. This one is direct injury, a stab wound. Whenever it's causing direct injury to the spinal cord, it's unstable. Otherwise, it's stable. Actually, this is a distraction injury. Actually, this particular hangman's fracture, C1, C2, the fracture of C2 vertebra causes death immediately, and this one is actually a distraction injury. Coming to flexion injury, which is the most common injury in the spinal cord injury, the cause includes fall from a height on heels, which may also cause injury to calcaneum. So lateral view X-ray of calcaneum is needed after clinical examination. Or fall from a height on buttocks. A heavy blow across the shoulder by a heavy object uniformly. Whenever it's on one shoulder, it's cause flexion rotation injury. But a heavy blow across the shoulder by a heavy object uniformly towards both the shoulder, it causes flexion injury. Heavy object falling on flexed spine. It may occur mostly in a work area, mainly building construction area. It may occur whenever the patient is on lumbar flexion position. A heavy object falling to the flexed spine may cause flexion injury, and it results in compression fracture. Compression fracture. The most common site of compression fracture is in between T11 and L1, in which T12 is the most common site. Anterior wedge compression fracture occur. Sprain of ligaments. Dislocation of vertebra in cervical. Cervical area is cervical spine is more prone to injuries. There is a chance of dislocation vertebra in cervical, but it can be managed. It can be reduced in continuous traction, and so that in most common conditions, flexion injury is a stable injury. And already I told that wedge compression fracture in dorsolumbar region. Please take flexion and extension view of cervical spine. Lateral cervical spine should be taken in flexion and extension to rule out the flexion injury in cervical spine. If the injury occurred to cervical spine, the X-ray advised should be lateral view X-ray in flexion and extension. Hope you understood. Lateral view X-ray of cervical spine in flexion and extension should be advised. Coming to flexion rotation injury, it's the worst injury, highly unstable and cause neurological damage. Heavy blow on one shoulder. It causes flexion and rotation of spine. Blow or fall on posterolateral aspect of head. It also occurs flexion and rotation, and it results in fracture and fracture dislocation of vertebra, mainly in cervical. Also fracture dislocation in dorsolumbar. Whenever it's affecting fracture dislocation in dorsolumbar region, mostly it may be a cord transection, spinal cord transection, which causes permanent damage. And it's about flexion rotation injury, which is the worst injury. And how the injury occurred, I already explained that. How the injury occurred, what will occur. Due to this particular injury, this will happen, and the prognosis is like this. It's the basic thing which we are discussing in this particular video. This is flexion rotation injury, fall of a particular object on one shoulder, which causes rotation with flexion, which causes fracture and fracture dislocation. Coming to vertical compression injury, the cause include blow on top of head, directly blow on top of head, or fall from height in erect position, that is in Shirshasana position, fall from a height hitting head, which causes vertical compression injury, which results in burst fracture. Burst fracture may occur due to other injuries also, but this vertical compression injury causes burst fracture. Please note that whenever a piece from a burst fracture displaces into spinal canal, then it's unstable. Otherwise, it's stable. This burst fracture won't be healed. Anterior wedge compression fracture also won't be healed, but in flexion injury, it shall be managed conservatively with vibandha bandha. At the site of fracture, we shall able to do bandage whenever it's in dorsolumbar spine. Whenever there is a dislocation of cervical spine due to flexion injury, then it requires continuous traction. Continuous traction is a method of immobilization. Coming to vertical compression injury, the result is a burst fracture. Whenever there is a piece dislodged from that particular vertebra, dislodges to the spinal canal, then it's unstable. Surgical requirement is needed. Otherwise, it's a stable injury. This is vertical compression injury, falling in erect posture, hitting head directly. Coming to extension injury, it's very common in cervical spine. Extension injury is very common in cervical spine. The cause includes two things. One is motor vehicle accident, forehead striking windscreen, and second one is shallow water diving. Shallow water diving also causes extension injury. It actually results in chip fracture of anterior rim of vertebra due to the pull of anterior longitudinal ligament. Anterior longitudinal ligament pulls the anterior rim of vertebra, which is the end result of extension injury. Actually, this is a stable injury. The reduction of extension injury is flexion and kept in neutral position. The most common injury is flexion injury. The extension injury only occurs mainly in cervical spine, and this extension injury, the reduction is in neutral position, flexion up to neutral position, and continuous traction should be advised for a minimum period as part of immobilization. Whenever this extension is kept for a prolonged time, then that becomes unstable. Otherwise, it's a stable injury. Actually, this is hitting a windshield. Shallow water diving also causes extension injury. Coming to flexion distraction injury, which is rare nowadays, it's also called as seatbelt injury. In earlier days, seatbelt was only on the abdominal part, not over the chest part like this. And whenever there is a seatbelt and the vehicle collides, this seatbelt is over abdomen, but the upper part goes towards anteriorly due to inertia. Whenever there is a motor vehicle accident, and here at the abdominal area, the seatbelt presses back and anterior part, upper part will goes anteriorly, which causes a traction. And this particular injury causes chance fracture. Chance fracture is horizontal fracture across the body of vertebra, which causes unstable injury. This flexion distraction injury is actually an unstable injury. Actually, the fracture is a chance fracture, horizontal fracture across the body of vertebra, which causes displacement. And this flexion distraction injury is rare nowadays, which requires surgical correction if it happened. Coming to direct injury, which is rare, cause includes bullet, lathi blow, or a stab wound. Stab wound may also cause direct injury. Lathi blow only causes spinous process fracture, which is a stable injury. Bullet injury as part of on which site injury occurs. Whenever it hits spinal cord, then it becomes unstable. Or a stab wound, whenever it hits spinal cord, it's an unstable injury. Otherwise, it's normal. Coming to the last, violent muscle contraction. Indirect injury. Actually, this is an indirect injury, rare injury, cause sudden violent contraction of the iliopsoas muscle, and it results in transverse process fracture of lower lumbar vertebra. Actually, we shall able to diagnose it by palpation itself. The spinous process shall be palpated. From spinous process, this transverse process is at a distance of total 5 centimeter. The tip of the transverse process from the spinous process of that particular vertebra is 5 centimeter, and we shall palpate that particular area. By that itself, we shall able to diagnose, and X-ray AP view of LS spine may reveal the fracture. X-ray itself gives fracture. In this particular condition, we shall able to bandage it with hip spica, and Matravasti shall be advised as part of pain management, because Susruta already advised Matravasti or Snehavasti in Kadi Bhagna, so that we shall incorporate that technique as part of pain management and immobilize up to the period of complete relief of pain and tenderness, and after that gentle rehabilitation shall be advised in this particular injury. This injury occurred to Neymar in 2014 World Cup. In 2014 World Cup, Neymar had this particular injury. Indirect injury due to violent muscle contraction, transverse process fracture occurred. Coming to the conclusion of this 7 spinal cord injury, first one is flexion injury. The flexion of spine is the reason. Most commonly affected area are cervical spine and then dorsolumbar spine in between T11 and L1, which is stable and is possible to manage conservatively. Whenever there is dislocation of cervical spine, it includes continuous traction and it needs reference. I mean, to flexion rotation injury, worst injury, flexion along with rotation is occurred, which requires a reference. In most conditions, there may be a chance of co-transaction in the dorsolumbar area. Coming to the third injury, vertical compression injury, when it's occurring due to direct hit overhead or fall on erect posture, it may cause a unstable injury whenever the crush fracture, that particular piece dislodges to the spinal canal. Then it's unstable. Otherwise, it's a stable injury. Fourth one is extension injury occurring due to hit of head on the windshield, or shallow water diving is the cause, in which it may be more commonly stable. The anterior longitudinal ligament pulls up the anterior rim of vertebra. The important thing regarding extension injury is flexion of spine up to neutral position and continuous traction shall be advised as part of immobilization. Coming to the fifth one, it is flexion distraction injury, which is rare nowadays. Flexion distraction injury is an unstable injury occurring due to a hold over the abdominal area and distraction of the spine, which causes chance fracture, a horizontal fracture across the body of vertebra, which displaces. So that it's an unstable injury. It's not a stable injury, it's an unstable injury. Coming to sixth one, it's direct injury, a rare injury. And this seventh one is indirect injury due to violent muscle contraction. This is vertical compression injury. And this one is extension injury. And coming to the prevention of spinal injury, which is very important in all countries, developed and undeveloped countries. In everywhere, this prevention of spinal injury is considered as an most important thing, and as part of prevention for public, all doctors shall give the message to the public to prevent the spinal injury. First one is, the most common cause is motor vehicle accident, so that drive safely, it's very important. And check water depth before diving to avoid extension injury. Prevent falls. It shall be possible when we keep this in mind. It is possible. And take precautions when playing sports. It's important. And all those who are playing sports should keep in mind to prevent or avoid injuries. So that that particular sports event should be learned well, and before each sports activities, ask the particular person to do regular daily workouts and to be properly hydrated. Don't drink and drive to avoid motor vehicle accident. And this prevention is of utmost importance. Regarding spinal cord injury, we discussed about how the injury occurs, what is happening in that particular injury, what is the prognosis of each injury, and at last we discussed about the management, whether it is possible to manage conservatively or surgical reference is needed. Thank you.